The external surface of the neurocranium, or exobase, is practically divided in three areas by two conventional transversal lines. This is the first one, anteriorly placed. It's called the bizygomatic line, crossing the middle of the zygomatic arches. And then the other one is passing through the apices of the mastoid processes of the temporal bone. So this is the bimastoid line. Between these two lines we have the three areas. Anteriorly we have the facial zone or facial area, then we have the middle zone or jugular area, and then we have the posterior zone or occipital area. Since the anterior part of the base of the neurocranium is covered by the viscerocranium completely, we don't have a visibility on an articulated skull. So I'm going to just use this partial skull to discuss some parts of the viscerocranium that evidently cover the outer surface here. Eventually, if we wanted to remove it, we should cut right here in order to remove the entire viscerocranial area from the base of the neurocranium. But what's visible of the base is this surface, which is the pars orbitalis of the frontal bone, the orbital surface of that. So the features that we eventually will be able to distinguish are margo supraorbitalis with incisura supratrochlearis right there, and foramen supraorbitale up there. Then, as we continue downwards, not entering the orbit, we will have processus frontalis of the maxilla with crista lacrimalis anterior on it, and then margo infraorbitalis that partially belongs to the maxilla and partially belongs to the zygomatic bone. Then on the anterior surface of the maxilla, we will have incisura nasalis, which with the opposing incisura nasalis creates together the apertura piriformis, which has a pear-shaped, which is pear-shaped, that's why it's called apertura piriformis, is the anterior opening of the bony nasal cavity. And it has this anterior protrusion inferiorly, which we call spina nasalis anterior, for the attachment of the cartilaginous nasal septum. Then the anterior surface of the maxilla shows a couple of features. We will have these protrusions created by the alveolar process, the roots of the teeth. We call them juga alveolaria altogether. Right above the incisors, we will have fossa incisiva. Then the proeminence provided or given by the canine, it's eminentia canina, and above that and a bit lateral we will have the fossa canina of larger depression. Right above fossa canina we'll have the foramen infraorbitale that continues into canalis infraorbitalis and then also in sulcus infraorbitalis on the orbital surface of the maxilla. Then the posterior end of the anterior surface is this crest, crista zygomatico-alveolaris, and then we pass into the posterior surface of the maxilla with tuber maxillae and foramina alveolaria, a couple of small openings for the vascular nervous bundles that go to the posterior teeth. So this being the maxilla. Now the zygomatic bone has, as mentioned before, the three surfaces, three extensions and three openings. We have the lateral surface, we have the orbital surface, and we have the temporal surface right here posteriorly. We have the extensions, processus frontalis, processus maxillaris, and processus temporalis, processus temporalis of the zygomatic bone. The openings are foramen zygomatico-orbitale towards the orbit, foramen zygomatico-faciale, either of these because we have two here, and we will have foramen zygomatico-temporale in the back. So this being the frontal view, we are going to go to the inferior view to see the alveolar process of the maxilla and also the palatine or the palatum durum, the hard palate entirely. So the alveolar process of the maxilla holds the teeth, the upper teeth. We will have the alveoli of the teeth, alveolus dentalis, individually called. They are separated from each other by these bony septs we call septum interalveolare, and individually within some of the alveoli, we will have inside separations we call septa or septum interradicularem in singular, for teeth that have multiple roots. Now in the middle we have the processus palatinus of the maxilla, and the hard palate is made up by these in its anterior 2/3, and posterior 1/3 is made up by the horizontal plates of the palatine bone. The sutures between these are obviously like this, across like a suture line. We have sutura palatina mediana and sutura palatina transversa, obviously. On the inferior surface of the hard palate, we will obviously see the sulci palatini that are for the vascular nervous bundles, created by the vascular nervous bundles that go on the hard palate. And at the anterior end of this suture, we have canalis incisivus, that is practically a V-shaped tunnel that connects the hard palate to each of the nasal cavities with openings individually for each there. Now posteriorly on the palatine bone we have the openings we call foramen palatinum major, which continue into canalis palatinus major, obviously both of them on both sides. So if I put the pointer through, I should be able to pinpoint the location of the target. I could not here, so I should be able to pinpoint the target of these communications. Let's try on this side, and that is, you can see inside fossa ptericopalatina. So canalis palatinus major is a communication of the hard palate or the fossa ptericopalatina with the hard palate, and we also have foramina palatina minora, the lesser openings that are openings of the small or lesser palatinal tunnels that are also connecting the ptericopalatal fossa to the hard palate. Now this was the facial skull, or the surfaces or the features that we could see there. And now we're going to move on to the middle area between the bizygomatic line and the bimastoid line. This is the jugular or middle area of the endobase. The bony surface is complex. We have the inferior surface of the sphenoid bone in the midline, continued by the pars basilaris of the occipital bone, also in the midline. Then going out laterally, we have the pterygoid processes. Then all the way out, we have the infratemporal surface of the ala major, of the greater wing of the sphenoid bone. Then returning here, we have the inferior surface of the petrous part and the inferior surface of the pars squamosa of the temporal bone. Also, partially the tympanic part of the temporal bone contributes to this bony surface. Now the communications are as follows. We start with this communication we already mentioned. It is canalis palato-vaginalis. It's created between the upper end of the vertical plate of the palatine bone right there and the processus vaginalis of the body of the sphenoid bone. Then the next one is going to be this one, the foramen lacerum, the big communication, which in living people is practically obliterated by cartilage. So it's not really a true opening. It contains some nerves that pass through here though in the cartilage. Then the next communication is obviously foramen ovale, connecting to fossa crani media, followed by foramen spinosum, also to fossa crani media, exobase, infratemporal fossa. And then we will have just an explanation here. This is spina ostis sphenoidalis right there, follow that. And that's what is giving the name to foramen spinosum. That's why we call it foramen spinosum. Then, right at the base, next to foramen spinosum, we will have a small, not so small though, tunnel, which we call, let me try to push the pointer in. This is where the pointer is the canalis musculotubarius. Look at the opposite side there. This is also canalis musculotubarius. So it's practically a tunnel that is oriented obliquely into the pars petrosa, and it has two subdivisions, semicanalis musculis tensoris tympani and semicanalis tubae auditive. And as you can see, the tunnel itself continues into sulcus tubeauditive. That is the area where the cartilage of the eustachian tube is attached to. Now, moving on, we will have obviously canalis caroticus and foramen jugulare, the jugular opening right here, or even better here, foramen jugulare, that is created by the incisura jugularis on the occipital and incisura jugularis on the temporal. We will have on the occipital processus intrajugularis, and on the occipital processus jugularis, and on the temporal bone we will have processus intrajugularis right there that subdivides the foramen jugulare into an anterior and posterior parts. Now, in order to see the little details, I'm going to zoom in on this area here. Just a sec. So I zoomed in on the area. As you can see, this is canalis caroticus, and inside canalis caroticus we have a couple of small little openings that we call foramina or canaliculi carotico-tympanici. That are for little nerves that go into the middle ear. And then we have in the back the fossa jugularis, the jugular fossa of the temporal pars petrosa of the temporal bone. And then in the depth of it, I don't know if we can really see that, we will have this little canaliculus mastoideus right there that holds a branch of the vagus nerve that goes into the mastoid area. Then, by definition, between canalis caroticus and fossa jugularis, we have this triangular depression, which we call fossula petrosa, that has a lateral opening, which we call canaliculus tympanicus, and the medial one, which we call canaliculus cochleae. Canaliculus tympanicus, this one, holds, right there, you see that, holds a nervus tympanicus of Jacobson, which is a branch of the glossopharyngeal nerve, cranial nerve 9. Now, if I turn the whole thing like so, to have it from lateral, to see it from lateral, we will be able to see, I'm going to also tilt it just a bit, we will be able to see that we have the processus mastoideus and the mastoid part here, and then we have the squamous part here, pars squamosa. Between them, the pars tympanica is inserted, and we have the fissures of the temporal bone present here. So, right here between the pars tympanica and pars mastoidea, we will have the fissura tympanomastoidea, and between the pars tympanica and pars squamosa, we will have the fissura tympanosquamosa. And then we will have something else. As you can see right here, we will have an inserted part of the pars petrosa. This is called crista tegmentalis. So between crista tegmentalis and pars squamosa, we will have fissura tympano. Just a sec, because the pointer is not behaving as I would like to. So right here, we will have fissura petrosquamosa. And in the back, we will have fissura petrotympanica, as you can see it right there. I zoomed back out to have the full visibility again. So we are going to go to this communication now, which is practically the foramen stylomastoideum, which is the end of canalis facialis within the temporal bone, and it's between processus styloideus and processus mastoideus of the temporal bone, foramen stylomastoideum. Then we will have medial to the mastoid, since we are here, medial to the mastoid, we will have the incisura mastoidea and sulcus arteriae occipitalis. Now, for the bony surfaces and features that we still need to talk about, we have the processus pterygoideus anteriorly, descending from the body of the sphenoid, with lamina medialis and lamina lateralis right there, which obviously will have between them the fossa pterygoidea, and at their peak we should have an incisura pterygoidea, but it's not there because it is completed or filled in by processus pyramidalis of the palatine bone that goes all the way here. This is processus pyramidalis. Then at the base of the pterygoid processes, we have fossa scaphoidea, That next to it, we already mentioned the sulcus tube auditive. Then going to the midline, we will have this single protrusion, which we call the tuberculum pharyngeum. But this made me remember something that I didn't say at the communication part, and that is an important communication at the base of the pterygoid processes. There is an opening that we could cannulate like so. Yes, so that is called it's going in, it's the canalis pterygoideus. But I can show canalis pterygoideus so much better if I point like so. I'm gonna put it similar to that so that we can see where we are. Look at that. And the canalis pterygoideus is practically this tunnel here at the base of the pterygoid processes. If I push the pointer through, you can see it appearing. It went sideways this time, but I can maybe try on the other side. You can see it appearing in, again to the other side maybe, but you can see a bit of red in there, I hope, in fossa pterygopalatina. So it's a communication that will cross the base of the pterygoid processes in a anteroposterior direction and eventually create it like so, and create a communication towards or into the pterygopalatine fossa right here. Now, continuing with the surfaces here, we will have a subdivision also here. This subdivision eventually is based on the structures that are present at the base of the skull. So between the two sagittal planes that I'm showing here, kind of starting at the pterygoid processes, we have the middle area, or called the pharyngeal area, because this is where the pharynx is in the middle. And then there is the lateral, the two symmetrical lateral areas that are subdivided into three: an anterior, a middle, and a posterior area. The anterior area is practically the infratemporal fossa, or the infratemporal surface of the ala major. The middle area is the joint area, the articulation area, where the ATM is, the articulatio temporomandibularis, which eventually has the tuberculum articulare anteriorly and the fossa mandibularis posteriorly. And then we have the last area, which we call the jugular or vascular, the vascular nervous area, because of the big vascular nervous passages at the base of the skull in this region. So these are the features that we wanted to say in the middle or jugular area. And then, no, before we go on, I again forgot another communication, which is this one, which is canalis palato-vaginalis, which is created between the vertical plate of the palatine bone, which is right there, and the vaginal process of the body of the sphenoid. So this is canalis palato-vaginalis, creating a communication between the pharyngeal wall and the fossa pterygopalatina. Also in the midline, we obviously see the vomer and the vomer itself, and the ala vomer is the two wings of the vomer bone. And then eventually we go all the way back to the posterior area, which is the occipital area. As you can see here, we have as surface features the condylus occipitalis, fossa condylaris behind it. Already mentioned in the previous discussion, the incisura mastoidea and sulcus arteria occipitalis. And then on the squama, we will have the crista occipitalis externa, going all the way up to the protuberantia occipitalis externa. And then the lines, the horizontal line going at the level of protuberantia occipitalis externa is the linea nuchalis superior. Under it we have linea nuchalis inferior, and sometimes we have a linea nuchalis suprema, but it's not always present on all skulls. And then we will have the openings. Obviously we have a big opening foramen magnum for the communication with the spinal canal. Behind the condyle in fossa condylaris, we have the start of the so-called canalis condylaris that theoretically should pass through, as seen here, at the base of the condyle in an anteroposterior direction. We call that canalis condylaris, holding the vena emissaria condylaris. Also at the base of the condyle, we have this, I don't know how to put it through, but you can see it's right there. We have the canalis nervi hypogrossi, which crosses like so, but from the exobase is seen like this. It's practically crossing transversally the condyle, or the base of the condyle. And then we will have one last thing, which is the canalis mastoideus, or foramen mastoideum, better yet. This is foramen mastoideum that will hold vena emissaria mastoidea, that theoretically, but it's not going to today, should pass through the bone to reach into the same sinus like the previous one. Oh, but you can see that there, into sulcus sinus-sigmoidei, to create a communication between the endo and exocranial venous systems. So the contents of foramen mastoideum is going to be called vena emissaria mastoidea.